And welcome to Current Topics in Dental Health. I'm your host, Dave Dobbins, and this show is a series of programs that we will be doing and have done about your dental health, things that are relating to our teeth. So please welcome our distinguished guest, Dr. Charles Horning. Thank you for coming. Dr. Richard Mullins and Dr. Thomas Partridge. Welcome, gentlemen. We are going to cover an array of topics today, but let's get started with the first topic, and that's periodontal pathogens and cardiovascular disease. So let's start out by clarifying what pathogens are and how it affects our cardiovascular health. I'm going to direct this to Dr. Partridge.
Okay, that's a good first start. Very current topic in dentistry. The pathogens, of course, are the bacteria that accumulate in our mouths, and there are quite a number of bacteria that are potentially very toxic. They cause periodontal problems, gum disease, root canal problems, cavities, but they also can affect the vascular system, our vascular trees, in two different ways. Directly with the bacteria, but more significantly, discovered recently, are the inflammatory chemicals that are released from dental infections. They go into our bloodstream.
Wow.
And they apparently contribute to the contribution of plaque in the vascular tree, including heart disease and possibly brain problems and other areas of the body. A more recent discovery and correlation has been established between low birth weight babies and women who have active gum disease, or what we used to call pyorrhea.
Wow.
And a number of studies seem to corroborate this. But I will say there's some other studies that tend to negate some of these findings. So it's still a not completely defined circumstance.
How can we reduce the amount of pathogens for, and I think about adolescent, it kind of pops into my brain first with, and we're going to talk about this more later, just the amount of things that children will eat or drink, and then they don't brush their teeth. Or they put their hands in their mouth after they've touched something that's, dirty, shall we say.
Well, children are remarkably resistant, for one thing.
No, that's true.
We floss teenagers' teeth, and some teenagers don't floss their teeth, and we find some very nasty bacteria, nasty germs, but they don't have gum disease. But when that teenager is 30 or 40, those same bacteria can cause lots of problems.
Right. So it's just kind of funny, because if you think about the cardiovascular issue, which is something that when you're young you don't think about. But as you get older and you start having people that are having heart attacks or open heart surgery or whatever, you start thinking, when you hear something like that, you start thinking, wow, how am I doing with that? Am I flossing? Am I getting my teeth cleaned? I didn't know that even affected my cardiovascular makeup of my body. So that kind of is alarming to me anyway.
The potential is there, no question, for bacteria of the mouth to affect our heart valves and our vascular tree, no question about it.
Okay, we're going to try to present a lot of, hopefully some good answers today. So what would be one of the first tips that you would give to keep that from occurring?
Well, good dental care, good dental cleanings with your dentist or dental hygienist, and home care. That's very critical. Dental floss and adequate home care to keep these bacterial populations from living in one's mouth.
Using an electric toothbrush.
An electric toothbrush.
So that
what's the difference
the individual can overcome shortcomings in their technique. The electric toothbrush has been shown to significantly reduce plaque in comparison to manual toothbrushing. As an aside, to make sure that your audience understands, the same bacteria that have been cultured in the mouth from periodontal disease have also been cultured in and around the heart after a heart attack, for example. So the direct link has not been absolutely established, but the circumstantial evidence is such that it would give one pause. You cannot possibly be wrong in keeping your mouth clean.
You heard it first. That's good. Any other thoughts, Dr. Mullins, on this subject before we move on?
I just had a visit to my own physician, and she advised actually good nutrition, healthy habits, and also to keep your teeth clean. So physicians are starting to understand this a lot more now.
Just on one teeth cleaning recently, they took my blood pressure. I'm like, what are you doing?
Absolutely.
She said, oh, well, we always do that. Wow. So I thought that was great. I think there's some cross-pollination between the dental and medical community, so that's really exciting to hear. Okay, so if we exhausted this one, we'll move on to the next. All right, let's talk about something that I am fascinated by, CBCT use in dentistry. And so I must confess that I didn't know what that was, so I'll act important and tell you that that means cone beam computed technology. Did I say it right?
Tomography.
Tomography. First of all, what is it, and how does it help us in dentistry with our patients? And that would be Dr. Mullins.
Okay. It's been something developed in our specialty, endodontics, probably for about 6 years or so now. And it allows us to take an x-ray of an area of the jaws containing our tooth that we have some issues with. And this x-ray information, similar to a CAT scan at the hospital, will allow us to then access through software the information from our x-rays. And it also allows us then to actually see three-dimensionally a tooth area in several planes. If you've seen a CAT scan before, we have several different planes, from the nose to the back of the head, top of the head to the chin, and also ear to ear. So all of these planes actually can be seen on the x-ray technology then from our cone beam. This allows us to do a little better as far as diagnosis and also treatment planning, and it just gives us some information, a lot more information as opposed to a singular x-ray image.
So we're talking about CBCT, if you just joined us in dentistry, and so would this be good for impacted wisdom teeth or maxillofacial issues?
Absolutely. It's been available to the oral surgeons and orthodontists for some time. Their machines generally do a larger image that will actually do the whole jaw area. As an endodontist, all I'm concerned about is a certain area of a particular tooth. So I'll have, a focus of information that's going to be a little more limited.
I know Dr. Partridge can speak to its use in implantology, for example.
Right.
Yeah, we left out periodontists, and I do want to say that we use this type of technology in our dental implants a lot. Bone augmentation and dental implants.
So you have to see where the bone structure is so you know what you're going to do.
Nerve structure, bone
Yes.
structure,
Right,
exactly.
right. Nerve structure too. And I can't wait to get to the root canal part that we talk about later.
May I?
Yes.
Just as an example, if one were to visualize this particular tooth from an x-ray, 2 dimensions, you would see alongside, and you could tell, for example, if there was decay alongside. But if there were lesions or other areas of trouble, you would never potentially see it on a 2-dimensional x-ray.
And you might miss it.
And you might miss it or misdiagnose it. With CBCT, you can rotate this image in 3 dimensions and see all aspects of the tooth, from the root down to, up to the top of the tooth, and in all dimensions. And it gives you a much clearer, more diagnostic picture. And for example, as Dr. Partridge just described, if the nerve is running very close to the roots of the tooth, you can then visualize it in 3 dimensions to know exactly where you are and where the sinus may be and how deep it is and how it may affect the placement of the implant with Dr. Partridge.
Mm-hmm. It was interesting when I read that the first oral radiograph image was taken in 1896. I'm sure that they didn't have this same kind of technology that you're talking about. But
Hardly.
It's amazing that we have that kind of history, dental history, that they started thinking about this kind of imaging way back when. Is that a true statement? It was on the internet.
So it must be true.
Actually, it's been around for some time in the medical field.
Mm-hmm.
And the dental field has, probably since the early 2000s, is actually grasping a lot of this technology.
It probably helps with the computer technology that we have. Okay, so if you are in a place where you've got problems and an impacted tooth, or the jaws are not lining up, or root canal issues, this technology will be helpful.
Yes.
And so I would seek that out.
Yes.
Correct?
Well said.
All right, let's move on to the next subject, and we've touched briefly on this before. Let's talk about nutrition, Dr. Horning.
Yes.
And our teeth. When we think about nutrition, it's really a vast subject, and we don't think about how nutrition affects our teeth. As I said, we did touch on that earlier. Tell us what certain foods are danger foods to our dental health, and what foods we should avoid. And I'm sure you're going to get into drinks, soft drinks,
Yes.
and so forth, as we talked about before we started filming. So, nutrition for your teeth. Talk to me.
Critically important, as we have been the beneficiaries through several generations of fluoride, not only in our water supply, but also in our toothpastes, for example. The baby boomer population has been significantly rewarded by having fluoride in the food supply, and that has reduced the level of decay.
So fluoride does do that.
Fluoride
Helps
absolutely
to-
does do that.
Okay, great. Because I was kind of curious about that.
There's no question in my mind, certainly. What we're seeing now in dental practices is a deterioration of the dental health of the individuals we're seeing, especially in the younger population, where soft drinks, for example, have become so much a part of everyday life. There are more soft drinks consumed than water and milk in the average teenager. So areas that were very small areas of decay several generations ago are now devastating areas of decay because of the acids and the sugar content that is now present in soft drinks and high sugar content drinks.
It's higher.
Much higher now. The pH, normal pH, for example, as well as the acidity, normal pH 6.7, many soft drinks are 2.2, which is getting close to battery acid. So you throw that in with the high sugar content and the caffeine, and you have a generation that has an incredibly unstable diabetic potential, as well as blood pressure issues, increased heart rate. We are slowly but surely, and this is strictly my opinion, but supported by many facts, that we are compromising the overall health of our younger generation. And if I were a supervising adult, I would certainly want to limit, if not eliminate, soft drinks and high sugar content foods from the diet of my children.
So the children are consuming, they go to bed, they get up the next morning, they're off to school, they forget to brush their teeth. So now you've got 2 days worth of acidic that's staying on the teeth, eating away the gums. And so what do we do about that? How do we change that scenario?
But that's
Like
a good
you said, the
that's a
parents.
good question. The parents need to understand that these so-called fruit drinks don't have fruit at all. They're just acids. It's acid and sugar, various mixtures to give this flavor of whatever they want to call them. The more bubble they have, the more fruit, citrus type flavor, the more trouble they are. And we have to change our habits. We just have to change our habits.
Well, you know, the thing that comes to my mind, what about, you know, tomato juice, pineapple juice, you know, things that are actually, I mean, you have to read and see, like you said, a lot of times there's a lot of sugar added, but what if it is actually natural? Tomato juice, for example. Now, tomato is very acidic, so is that good, bad, indifferent?
You're not going to have a large consumption of tomato juice. Used in small quantities, generally not a problem.
Yeah.
You know,
But better.
but perhaps better, water, milk, as we all grew up with, certainly in our generation,
Right.
is far superior.
Right.
And what parents need to understand, if they take their child to the dentist and they're assuming reasonable health, and they come back with a report of 3 or 4 or 5 or 6 cavities, and those cavities are hundreds and hundreds of dollars, a parent should perhaps rethink the diet, because not only is it destroying the dentition, but it's injuring the future health of that child.
Yes. Okay. So parents, be on the lookout. Those of us that have children and maybe even grandchildren or nephews and nieces, think about what they're drinking, what they're eating. There's probably, we could probably take an entire program to talk about the foods that we should avoid. So you're probably smart for not pointing all of that out. We don't want to be critical, but we want to add knowledge. So
Absolutely.
Basically soft drinks, candy bars, a lot of the sweet things that we're consuming, ease back, and if you do have to eat it, if you find yourself chomping down on a candy bar, brush your teeth, floss, gargle. See, now I'm starting to sound like you. Let's move on to our next subject. If you've just joined us, we're talking about current topics in dental health with our distinguished guests, Dr. Charles Horning, Dr. Richard Mullins, and Dr. Thomas Partridge. I'm your host, Dave Dobbins. And so let's move on to plaque and root surface. Now, plaque is a thing we hear about on TV, usually when we're seeing some kind of a clear, clean commercial that promotes a toothpaste or a mouthwash, which is probably more infrequent than other commercials. No criticism, of course, but let's talk about plaque. What is plaque, and how does that affect our root surface? How do we get rid of this plaque? And whoever wants to grab this one.
Dr. Partridge.
Dr. Partridge?
Well, thank you for letting me grab
He
this.
is the king of plaque.
The king of plaque.
Plaque is a sticky substrate created by bacteria. They can break down our food, protein, fat, carbohydrate, and they make a glue. They make a long dextran glue. They glue themselves together. They glue themselves to teeth. They produce acids that cause caries, cavities. They produce enzymes that cause the gum to detach from the tooth, and you have pyorrhea. They're very, very destructive. They give you bad breath, and they're very destructive. They're not easy to remove, and some patients have plaque that is much stickier than others. Their bacteria produce more glue than other people's. And there's a bunch of genetics in this stuff, unfortunately.
Yeah, that's a really good point, because there are some people that do have more acidicness in their mouth. I'm sure you gentlemen deal with that every day. Some people, I remember having a conversation with a 25-year-old a couple of months ago. I'm 25, I've never had a cavity my whole life, but yet Dr. Horning and I had a conversation before we started about someone that I know that is 6 years old that has 5 cavities.
Yeah.
So,
Of course, home care and genetics. But you're not doomed to good home care, effective home care. I think the thing that Dr. Horning said about the electric toothbrush can't be overestimated. They're incredibly efficient, and much more efficient than Dr. Horning or Dr. Mullins or I can be with our own toothbrush. Electric brushes are very effective, and they're a real health aid.
okay.
Absolutely.
So and I think that's great too, because that's something that I never thought about. I think that's a great idea. So I'm learning too. Let's talk about the root surface. Well, what is that? I mean, should I care about my root surface?
Let,
how's
Dr.
your root
Mullins
surface
take that.
doing, Dr. Mullins?
Well,
My
it
what?
becomes exposed a bit more as we age. And so consequently, it becomes imperative for us to keep that surface cleaner. It's a little softer compared to the enamel-covered section of the tooth, the crown part, and our plaque problem also develops there too easily. Plaque is there always. It's always going to be there. Even if you brush, after 24 hours, it starts to reestablish itself. So it's a daily thing to floss and brush. Yes, itself. Yes.
Wow.
And so you have to keep things, clean every day.
I wonder what the good Lord meant for the plaque to be there for. I know you said it did other things, but it seems like it's something that's kind of bad.
That's a
I
good
don't
question.
know necessarily if we can blame all this on the good Lord. He didn't necessarily intend plaques to be in arteries
you're
either.
Probably right.
So the good Lord created the bacteria too,
yeah,
by the
that's
way.
true.
I don't know if he invented the electric toothbrush, though.
Yeah, I'm sure.
But boy, can that help?
Yes. Okay, good. This is fun. Just to kind of wrap this little subject up, do teeth cleanings help? How often should we get our teeth cleaned? Let's just throw that out there.
If you are at risk, as Dr. Partridge alluded to, then more frequent attention professionally is absolutely in order. The young individual that you described at 25 as having no decay, maybe they, either genetically or through better home care, are less at risk. They may not need to be seen as often as someone, say, in middle age who has root surface decay, had multiple crowns, a large investment in restorative dentistry. That individual needs to protect that investment, needs to prevent further problems, because either through genetics or bad luck or lack of fluoride when they were younger, is much more at risk, and they need that professional attention much more frequently, 3 times a year, 4 times a year.
Thank you. That's what I was looking for, a time frame, because I need to know.
No question.
Statistically, for many years, approximately 60 to 70% of Americans end up developing gum disease or pyorrhea
60 to 70%.
if they live long enough.
Wow.
And the answer to this, and a lot of genetics again about your resistance, the bacteria, but these people who, as Dr. Horning has said, are risk people, 3-4 month cleanings are really mandatory.
Okay, good. So, yes, sir?
It's a constant assault from the bacteria that we have to be aware of.
Right. Okay.
No question.
We probably shouldn't get into this too deeply, but gum, mints. Man, I just had a peanut butter sandwich. I didn't want to offend you, so I put in a little piece of gum and took it out quickly. How does that affect our teeth?
You're in trouble.
Okay.
No.
I mean,
Peanut butter good, gum not so much.
Yeah. I'm a gum guy.
Artificial aids
Yeah.
are of limited value. Mechanically sound cleaning, frequent attention. If you are not cleaning the bacteria away from the teeth, mouth rinses and gum are only palliative measures that may, quote, freshen the breath, but they do not do very much at all unless there's no plaque there to begin with.
What about if the individual has to ingest inhalers? Say someone has
That's a great question.
asthma.
Their mouth is going to be very dry and very susceptible to a multitude of problems. You can even have a fungal overgrowth in your mouth because of those inhalers.
Wow.
You can have, if you have any root surface exposure, you can get decay on the roots. It is of some significance, and if you are using an inhaler, you need to pay particular attention.
Okay.
And get advice from your pulmonologist or your primary care physician as well as your dentist.
All right. Thank you, Dr. Horning. We have time for one more thought. Not really a question, unless you have something else you wanted to add.
I'd like to address the dry mouth thing again.
Okay.
A lot of patients are on a lot of medications that are going to produce that. And you have to understand that saliva has a very beneficial value to it. And if we don't have saliva in there with some of its antigens that help to promote dental health too, then that's another factor that we have to compensate for. So saliva is very important.
And I know there are products out on the market for that. We're not here to promote a specific product, but there's a reason why there's I know this is not the proper term, but a specific pH balance in our mouths.
Right.
Is that the right term, though? I'm
Reasonably
getting
well said,
I'm getting
yes.
close. I'm getting
Yeah.
close. I don't know if we have enough time for this. We may have to drag this over into another program. Let's see if we can hit this quickly, gentlemen. Decay in the mature population. There's this subject is of personal concern for me. I have an aging parent that we are always concerned about her teeth. How big of an issue is this, and what can we do about it?
It's
Dr.
a large
Partridge.
issue. It's a very large issue.
Yep.
It's a little bit of a surprise. We're all living longer, and we have
Yes.
people with teeth. 30 or 40 years ago, the population at this age did not have the teeth we have now. We've restored them, we've saved their teeth, and we are seeing serious recurrent caries, cavities in our mature patients. It's a concern.
So what? No. So what is the way that we can help out with grandma and grandpa? How can we keep better tabs on our family members that are in a mature population?
Number one, supervision, maintenance, an electric toothbrush, for example, frequent cleanings if they are in a nursing home setting, high fluoride containing dentifrices, 5,000 parts per million, mouth rinses that contain 5,000 parts per million fluoride. Root surface decay is absolutely devastating in this population. They've spent decades trying to maintain their health, and as they age, the mouth is dry because of medication, a lack of saliva. They are losing their visual acuity, so they cannot see. They have lost their manual dexterity, so they can't brush on their own. And
Correct.
it becomes a total disaster.
Correct.
It is a never-ending battle to try to overcome.
Well, I mean, I wish that we could have maybe in the future a whole program
Yes.
about this, because this is of huge concern to many of us that have aging family members. So I would say stay tuned for the next time that we talk about the current issues in dental health, this being one of them. So I would like to keep going, but we have to wrap this up and ask you to tune in to ac-tv.com if you want to find out more information about this program and the future programs that we're going to do. And a lot of that information will be on YouTube as well for you. So thank you very much for joining us. Thanks for sitting through this fun topic about our dental health. I'm your host, Dave Dobbins, and we will see you next time right here. Thank you very much.